Hey listeners, it's Stephanie Wynn, your host of the Health and Healing from the Inside Out podcast, and I have got some amazing news to share with you. My brand new book, Navigating Inflammatory Bowel Disease, a 6-week blueprint for better gut health, is finally here and available for pre-sale. Maybe you or someone you know is struggling to figure out life with Crohn's disease or ulcerative colitis, which is 2 forms of inflammatory bowel disease or IBD. This book is written just for you. It's simple, easy to follow blueprint, packed with practical tips and real life advice to help you manage symptoms, find the right support, and feel more control. This book is like having a friend who truly gets it, like walking with you every step of the way. And the best part, you can get your autographed copy today. Just head over to navigatingibd.com to pre-order now. If you've been looking for answers, hope, or just a little guidance, Navigating IBD is here to help. Don't wait. Pre-order your copy today and start your journey to better gut health. Welcome to the Health and Healing from the Inside Out podcast with Stephanie A. Wynn, an online health and wellness podcast where I, your host, will provide weekly wellness tips about inflammatory bowel disease, specifically Crohn's and ulcerative colitis. The Health and Healing from the Inside Out podcast is a mixture of special guest interviews from healthcare professionals, IBD survivors, Crohn's survivors, ulcerative colitis survivors, and community thought leaders. Be sure to select the subscribe button and let's start the health and healing process from the inside out. We are back for another episode of the Health and Healing podcast. I am your host, Stephanie A. Wynn, and we are super excited for this episode because we have Dr. Jasmine L. Cohen Young. She's a licensed clinical social worker, and we are super excited today. Today is going to be, we're going to drop some jewels today. She's going to talk about what it is that she does. But before we get started, remember, we cannot start the healing process until you get your mind right. And so in order to do that, it's going to require you to get rid of some things. It's, friendships, relationships, partnerships, whatever ship you're on. Remember, you can't start the healing process until you get your mind right. Now, let's get into this. Dr. Cohen Young is a trailblazing social worker, mental health advocate, and educator dedicated to promoting holistic well-being among underserved communities, especially athletes of color. As the founder of Minds Matter Incorporated, she provides culturally responsive mental health services to youth athletes and uses sports to foster resilience. With a doctorate in social work and personal experience as a former athlete, Dr. Cohen Young develops innovative approaches to help athletes navigate sports, injuries, and life transition. A respected educator and thought leader, she's shaping the future of mental health in athletics. Through her groundbreaking programs like Champions for Change, Dr. Cohen Young tackles systemic barriers in mental health care while addressing the unique challenges athletes face both on and off the field and court, right? Her work highlights the importance of integrating culturally tailored mental health support into sports, empowering athletes to thrive amid adversity. Dr. Cohen Young's efforts extend to educating parents, coaches, and communities, equipping them with tools to support athletes' mental health and well-being. Welcome to the show, Dr. Cohen Young. Welcome. I'm super excited to have you.
Thank you for having me. I'm super excited to be here. The work that you're doing is amazing. So I am honored to be here with you and to share this space with you. And to just spread the word about mental health and its impact, especially on the IBD community, on our Black community, and just thoughtful ways that we can progress and move forward. And especially for those that are on their journey, right? On their journey of healing and trying to find answers, right? A lot of it is connected to a mental health journey. So I am ecstatic to be here to talk about it and to just drop some gems, give the people some insight and help them to navigate this a little bit better, especially in the new year, right? We're in 2025. So there's a lot that's going to be happening. So we need to make sure that our community is well equipped and that they have the resources and tools to get through any adversity that they may be facing. So super excited to be here. Thank you so much.
You're absolutely, I'm super excited that you're here with us. So let me get right into this interview. I want to start with number one, because, I always talk about you got to get your mind right. And so number one, we're going to talk about like mental health and chronic illness in the Black community, right? So chronic illnesses, including like inflammatory bowel disease, which is also known as IBD, often disproportionately affect the Black community. What do you see as the biggest mental health challenges faced by individuals living with chronic illness, and how can we better address this issue?
Excellent question. Let's jump into it, like you said. So, individuals living with like chronic illnesses such as IBD, right? They face significant mental health challenges. And these challenges are often amplified, like you mentioned, within the Black community due to systemic inequities. You have stigma, you have limited access to care, but not just any type of care. We want the culturally responsive care, right? And as you mentioned, that's something that I'm very passionate about, being that my initiatives and my missions are within that realm of being culturally responsive, because unfortunately, due to many events in history, if I may, without going down a rabbit hole, we are an affected population, right? It's not equal. It's not always fair. Our access to different resources and different treatments has not always been equal and fair. So with that, one of the biggest mental health challenges is the emotional toll of having to manage a lifelong condition, right? So, and that can bring about many feelings and emotions for a person. You think about isolation, you think about anxiety surrounding flare-ups that could happen, right? Depression due to physical limitations or societal misunderstandings, right? They look at you and, Stephanie, they could look at you and say, well, you look healthy, right?
Mm-hmm, yes.
But they don't know exactly what it means to feel and go through a flare up, right? Having IBD and not truly understanding the limitations that come with that. So chronic illness can disrupt a lot for an individual. It can disrupt their daily life. It can disrupt employment for certain individuals, social connections. It can have a severe effect on social connections. And that can leave an individual feeling unsupported or even more marginalized, right? Even more isolated in their spaces. So for the Black community, these challenges are compounded by many different tenets in life. So we got medical mistrust. We have systemic racism in the healthcare system. We even have disparities in access to mental health services. So many individuals may feel unheard. They may feel dismissed by their providers, and that can lead to a delay in treatment or even worsen outcomes for individuals. So you put that all together, and let's just not forget stigma, right?
Yes.
So we got stigmas around mental health in the Black community. It can be even harder for individuals to seek help and for emotional struggles to come with chronic illnesses as well. So we need to focus on, I'll give you 4 tenets starting off, right? So we're going to increase cultural competent care, right? So healthcare providers, this is to the healthcare providers, there's always going to be what we can control. And then there's going to be some components where we can't control, but we're still going to challenge those areas to do better and give us better as the patient, right? So healthcare providers, we need to be trained. We need to be trained to understand and address the unique needs of the Black community. And that includes that intersection of mental health, and physical health, right? Because I'm never going to leave my athletes out, but I'm always going to make it inclusive for everybody, because my mission is our community. My mission is all of us. We might be broken down in different subcategories, but I'm still here for us all. So we need to, as providers, we need to make sure that we understand the communities that we're treating, and that not only understand them, but make sure that our interventions that we're going to be using align with the population that we're going to be treating. So increasing culturally competent care is going to be number one on the list. Expanding access to mental health resources, right? This is for my insurance companies. Hear me when I say, right? This includes integrating mental health care into chronic illness management. This needs to be a part of it, right? We can't treat one and not the other. There's going to be an effect on each of them, right? If I'm not feeling well, 9 times out of 10, my mental health is also suffering. Depending on the longevity of the illness and how long it's been going on, how severe it is, right? There's going to be some type of impact on your mental health. But integrating the mental health care into chronic illness management, and then making therapy more accessible and more affordable. They go hand in hand, accessibility and affordability. You can say we dropped a clinic right here, but if my intake is still $150, $175 for my first intake, and then I still have to pay, upward close to, $160, $125, $100 for every session, that might not be affordable for a Black family. So we need to make sure that these resources are accessible and affordable. Community-based interventions, right? Partnerships. If anybody knows anything about a partnership, it is Stephanie A. Wynn, okay?
Yes, correct.
So partnering with trusted community organizations to normalize conversations about chronic illness, about IBD and mental health care, right? And that way we can reduce the stigma surrounding these topics, and making sure that people are encouraged to seek help.
Yes.
Don't go at this alone. Don't sit and think, I can do this. I'll just shut everybody out and put my head down and get through this. There's power in community. There's power in asking for help. There's power in partnership, right?
Right.
You may ask for something and you might get tenfold of what you asked for, but you have to ask. There's nothing wrong with asking. Mm-hmm. There's been communities and individuals that have grown and flourished simply because they understood the benefit of community and they understood the power of an ask. Does it make you weak? It doesn't make you less than. It makes you smart. It makes you efficient. Yes. It makes you proactive in any and everything that you're doing, because you're going to surround yourself with people and individuals that want to see you win, that want to help you on your journey, that want you to heal, right? So don't think that you want to go at any of this alone. Down to knowing what to ask when you go to your doctor's appointment. Yes. I know the Stephanie A. Wynn Foundation has literature on what to ask your doctors, what to bring to your appointments, right?
Correct.
Use that stuff. Use the resources because it's there.
It's there.
It's there. We just talked about reinventing the wheel. Don't do that to yourself. You're going to make it harder. Yes. My favorite saying, always work smarter, not harder, right? So community-based interventions is going to be that for us. Working together, not working, trying to go at it alone, right? Work together. And then also advocating for systemic change. Yes. Power in numbers. My voice alone, I'm sure I can say a lot, but if I'm coupled with other individuals that believe in the mission, that want to address, healthcare disparities at like a structural level. Yes. This is going to be essential to ensure equitable care for Black individuals, especially those living with chronic illnesses such as IBD. Yes. I can go to the hill and scream to the rooftop, this needs to be changed. But imagine if it was, 20, 50, 100 of us going there and, telling stories, letting them know that we're demanding change, right? So ultimately, we need to create spaces, right? Both in healthcare settings and in our communities where individuals feel seen, they feel supported, they feel empowered to prioritize their mental health alongside with their physical health. So that way they're getting that holistic care. So
And, I want to say this too, like for those that are listening out there, like, in our culture, in our community, there has been that stigma of if you go see a therapist or you seek help, like, don't go talk to them because they're going to think you're crazy. You know what I mean? Like that has always been a stigma in the Black community. And and that's one of the things we want to, like, we got to get rid of that. Like, we have to get rid of these stigmas. And it's nothing wrong with you asking questions or seeking out for help. When I tell you when I was diagnosed, again, went through 6 different doctors before I got to the right diagnosis, which is a problem, right? And so with that, the symptoms that I was explaining, like our symptoms and the science shows it, our symptoms shows up differently than other cultures. So when you talk about like, how do you explain your symptoms and do they understand what you're saying? And do you understand the words that this provider is telling you about this condition? Do you understand the terminology? And so when we go back to the providers, my quest is, before you start talking, you read all these acronyms and this medical jargon, make sure your patient understand what you're saying.
100%.
See, with me, you couldn't just give me no acronyms and jargon because I'm writing it down and I'm asking for you to explain it to me. But think about the patient that doesn't know or is just too tired mentally to even ask this question.
Check in with your patient 100%. Make sure they understanding what you're saying.
Right.
Make sure that they are, in a space to receive the information that you're giving to them, and spend the time with your patients. Mm-hmm. We understand that you have more patients and I want you to give them quality care too.
Yes.
But spend the time with your patients. Make sure you are answering their questions. Make sure that you are explaining it in a way that they understand. Because that's gonna be the key to helping them to get to the other side of this 100%. Because if they don't understand, they just going through the motions too. They're just there. They're just there.
And I know, like we talked about, and we covered a lot. We've talked about the mental health and chronic illness in the Black community. We talked about the cultural stigma around mental health. We even talked about like how to advocate, like in how we, advocating for yourself. So this is a question for, my people out here who are, have a chronic illness, whether it's IBD, whether it's diabetes, high blood pressure, or you're suffering with chronic depression. Like, what are some practical strategies or tools you recommend for individuals managing both chronic illnesses and that's associated with mental health? And how can they advocate for their mental well-being in the healthcare setting? And I know we talked about ask certain questions, but is there a question? I know they do that, when you go to the doctor, they ask you these questions like, do you feel like you want to kill yourself? Are you depressed? Have you been depressed in the last 3 days? Or, and I remember just laughing at one of them and it was like, have you had a drink today? And I was like, I wish I could drink. Right. But, I wish I could have a drink a time or two. That's how I was feeling. Like I was just, and they looked at me like, I was like, look, it's just a joke, right?
I'm just, we gotta laugh and keep you crying sometimes, right?
Crying.
Like,
so, and it was like, okay, like this. So every doctor's appointment, they're asking these questions. Have you felt depressed today? Mm-hmm. Do you feel like you don't want to go on? Like, I'm like, okay. I remember like losing my child and they asked this question and I'm like, I just went full term with the pregnancy.
Full term.
You're asking me, do I feel like I want to go on? Do I feel like I'm depressed today? Wouldn't you be depressed if you had to push out a baby? Like, I just really lost it. Like I did. I just lost it. And sometimes you have those moments where you break. And I think that one thing that made me want to like push the needle in advocating was because I couldn't let this thing that's fighting against me validate who I am. And that there's somebody else that does not have the strength that I do to say something. Mm-hmm. Right? I get emails, I get texts all the time. I feel like I want to cry. I feel like giving up. No, we can't give up today. Cry if you need to. Yep. But don't stay there. Hey there, listeners. It's Stephanie Wynn, your host of the Health and Healing from the Inside Out podcast. I'm super excited to share an opportunity with you. On Saturday, March 22nd, 2025, the Stephanie A. Wynn Foundation will be hosting the third annual Let's Talk IBD Health and Wellness Symposium at the University of South Florida, St. Petersburg. And trust me, you do not want to miss it. This year's theme is all about opportunity, bridging gaps in health equity, mental wellness, and quality of life. You'll hear from amazing keynote speakers like Dr. Jasmine Cohen and Dr. Jennifer Seminario, plus connect with others who truly understand the IBD journey. And here's the best part. My upcoming book, Navigating IBD, a 6-week blueprint for better gut health, will launch on the same day as the symposium. And I'm super excited because it will be available at the symposium as well. This guide is packed with practical tips and personal insights to help you or someone you love take control of their health. Register today at the StephanieAWynnFoundation.org and secure your spot. I can't wait to see you there and to personally introduce you to navigating IBD. Together, we'll navigate toward better health. Join us on March 22nd because where there's opportunity, there's hope. Peace. I know I said a lot, but I wanted to just, if there's a tool or something like an affirmation that we could leave our audience with, because I think so we just need help and we just don't know what we don't know, right? And so
100%.
What are your
100%.
thoughts on that? Empowering individuals with chronic illnesses.
Absolutely. So from a management perspective, right? So managing both chronic illness and the associated like mental health effects, right? I always am looking at it from a culturally responsive narrative. And I'm also looking at it from a holistic approach, right? So I want to prioritize a few things, right? I want to prioritize self-care. I want to prioritize advocacy, and then building that strong support network. So if we're going to look at building a holistic self-care routine, we have to set some core tenets in that. And I'll go through the three, but in there, the last one that I'm going to go through is probably the most important. But self-care, you hear it all the time. People talk about it all the time, but it has to be intentional. So we're looking at it from an emotional wellness perspective first, right? So we're going to incorporate any type of stress management techniques. I'm looking at mindfulness. I'm looking at meditation. I'm looking at journaling. I'm looking at therapy, engaging in therapy to process any type of emotions and reduce any type of mental strain that someone may be feeling. From a physical wellness perspective, because I want everybody to leave here and understand that a body in motion stays in motion. And how you move not only strengthens your body, but it also strengthens your mind. There's so many chemicals and endorphins, and there are so many positive effects that happen when you move, right? So prioritizing rest, prioritizing nutrition, hydration. We're looking at any type of gentle physical activity. I don't care if you're just sitting at home and you're doing toe taps in between your favorite show, right? You can go and take a 20, 30-minute walk, right? We just are looking for some type of activity, some type of movement, right? To maintain your overall well-being and manage your symptoms. And now this last one that I was harping on at the beginning, but I want to set it very clear, boundaries, setting boundaries. If you are not feeling well, it is okay to say no. It is okay to protect your energy by setting limits with your work, with social obligations, or any other responsibilities. Now, with that, that is where the connections come in, right? Dealing with a chronic illness, you probably will have flare-ups. You probably will have times where you are not feeling the best. But if you have established a network, or even if you are in the midst of a chronic flare-up, or you are experiencing some symptoms, it's okay to establish that network in the midst of the crisis. That's going to be key, because once it's established, it's there, it's solid, and you can call on your people, right? You could call on them. So setting boundaries. That's a part of self-care. That is a part of making sure that you are putting you first. It's like the analogy when you're on the plane, right? They say, put your mask on first before you help somebody else. Sometimes that's easier said than done. I have children, you have children,
Yes.
right?
Yes.
Like we have people that we may be caring for, and sometimes we want to put their mask on first, but you cannot, and this is probably the most cliche saying, but I probably say it like 50 times a day. You can't pour from an empty glass.
That's right.
You got to put your mask on first. You have to help you so that way you're whole and well. And in that, you got to set some boundaries. No is a complete sentence. Do you feel like going? No. No explanation needed. Can you do it today? No, I cannot, right? I can't do it.
Yes.
But so building that holistic self-care routine is going to be imperative. The connecting with the support networks, next best thing, right? Peer support networks. So join support groups, connect with the Stephanie A. Wynn Foundation. These are going to be people that understand the mission, right? They're going to understand IBD. They're going to have resources to give you to support you during, the hard times, right? So you'll be able to share experiences, reduce feelings of isolation, foster that sense of empowerment. Between my dad and my brother, they can make me run through a brick wall because they're going to make me feel so empowered that I can do anything I put my mind to.
That's right.
But that's the type of support that you need. Those are the type of people that you need in your life when you're faced with challenges, right? You want to open up to trusted friends and family so that way they understand and they too can be educated on what you're going through. Education is going to be imperative, even down to psychoeducation. That's what we call mental health education, right? We're just informing individuals about mental health diagnoses, any type of interventions, medications, whatever it falls within the mental health umbrella. We're looking at psychoeducation, right? But education is going to be so key in helping not only yourself, but helping others around you to understand and better support you. Please do not bring me lunch and it is, Popeye's chicken and maybe McDonald's and a large fry, right? I need you to understand what I'm going through, right? I need you to understand what I can put in my body. So that way, while you're trying to be supportive, it's all making sense.
I love that chicken from Popeyes. That used to be my deal back in the day. I used to get the 2-piece snack. Oh, yes. But you can't. But you can't. Like I feel you. Like that is so true.
So important. I'm telling you. Like if you want to be support and people, there are people out there, family, friends. You could join a support network. I mean, there are so many. IBD navigators through the Stephanie A. Wynn Foundation, like they want to help you. They want to give you these resources and be there for you. A part of it, though, is going to make sure that is making sure that they are informed and educated. I know, Stephanie, I know you take your navigators through an education process. Yes. You let them know, like, if you want to be here and be a part of the mission, half of it is having the fuel and the desire to help. But the other half is making sure that you're educated. So that way, when you're out spreading the word and the message, everybody's well informed and we're giving out the information and we can help too. We can be sufficient help and stewards of the mission. So building that holistic self-care routine, connecting with support networks, educating yourself about your condition, and also educating others. It's going to go way further than anything. And don't be afraid to engage in therapy.
Yes.
Therapy for some can be scary. You don't know what to expect. You don't know what you're going to talk about. And that's okay. But getting there, starting, making sure that you're connected with a therapist that is well-versed in chronic illnesses, right? Look for that. That's important. Just like if you were to experience any type of trauma, you want to go to a trauma specialized therapist, right? If you dealt with any type of abuse, right? Neglect, any type of harm, you want to look for therapists that specialize in what you may have gone through, so that way you can get the most benefit from the therapy. A mental health professional, particularly one experienced in chronic illness, can help you manage anxiety, can help you manage depression, and the emotional toll that's associated with your condition. Same thing I do with my athletes, right? They might injure themselves. They themselves may be struggling with a chronic illness, right? And because of that, they are trying to figure out how they can still function in a space in their sport, right? Same thing with our community. We have to have the mental capacity to get through what we're going through. If you are not mentally strong, where your mind goes, the body follows. If you feel like you can't do it, guess what? Your body's saying, well, let's just lay down today then, right? But if you have the mental capacity to say, actually, today is not the day. We're not just going to lay down. Like, let's get to this doctor's office, or let's connect with the Stephanie A. Wynn Foundation. Like, let's make these connections so that way I can feel empowered. I can feel like I can get through what I'm going through, and I can get well. I can find a place where I'm stable, I'm functioning. You know, I'm not allowing this condition to write my future, right?
Correct.
We can't do that. We can't do that. So we definitely, you know, I know it's a lot. I know we're giving you guys a lot.
Yes.
But I hope you all are hearing what we're saying, because mental health is so important.
Yes.
Especially when we are looking at our Black community, right? We are dealing with a lot. We're dealing with a lot within our Black community. But then you compound that with a chronic illness. You compound that with the stressors that come with that, right? You just double down. You just double down on it. So you have to attend to your mental health in these current day times. And even if you're dealing with any type of chronic illness, because you want to set yourself up for success. You want to set yourself up to be as healthy from a mental standpoint and a physical standpoint. You want to make sure that you are crossing all T's and dotting all I's. So last, I want to be intentional in saying this, because we talked about making sure that we attend to our self-care. And I named some different interventions that you can use: mindfulness, meditation, you know, engaging in therapy. But perspective is going to be key. So finding joy and finding purpose is going to help you to just be a little bit more resilient when you are faced with some of those challenges, when you are faced with going into the doctor's office and not having the support that you may have thought you needed, or going in and not understanding, right? Those can be some very hard, scary times. But if you are able to find joy and purpose in the morning and in the evening, you start your day with being positive, finding some joy and purpose, and you end your day with finding joy and purpose, right? So we're focusing on activities, relationships, passions. And like you stated, I know you stated this at the beginning, you might have to lose some relationships along the way because they just might not support your journey. But focusing on the ones that are giving you joy and purpose and are adding to your healing journey, right? These are what's going to bring you meaning to your life. This is what's going to keep you going in your darkest times. Chronic illness can feel just very all-encompassing, right? It's affecting so many aspects of life. But reconnecting with your sense of purpose can improve your mental resilience 1,000-fold.
And that's one of the things, like in my newly published book, Navigating IBD, Inflammatory Bowel Disease, a 6-week blueprint for better gut health. I talked about your mindset in IBD, and that it's not your fault because you were diagnosed with inflammatory bowel disease. That's one thing. And so one of the things, Jazz, like we do here on the Health and Healing podcast, is really provide our audience with these resources and tools. And like I said, this is just not going to stop here. And that's why we're having our 3rd annual. Super excited. I want to announce this. Super excited that we're having the 3rd annual Let's Talk IBD Health and Wellness Symposium, because this gives our community a safe space where they can come, they can get this information. Just a shout out, and I'm just going to put this in as a plug. Dr. Jasmine Cohen Young will be our opening keynote speaker there. this year. Super excited. And we have Dr. Jennifer Seminario, who's going to be our closing keynote. She's the director of IBD at Advent Health in Orlando. So I'm super excited. She's the director of gastroenterology. And again, we are going to have the experts in the building that you can talk to. You can't say what somebody on the street said. You come right here to the symposium and you get your information. And again, our goal is not just to talk about it, but to be about it. And in order to have better health outcomes, we have to have these type of conversations. Sometimes these conversations aren't the best conversations, and it may feel a little heavy, but guess what? When you leave the Let's Talk IBD Health and Wellness Symposium, you're going to be empowered to take back your health, to get an understanding, get the right team around you, get the right support system, like Jazz said. And I'm sorry I called you Jazz, but
you are fine. But that's what I like. I like when people call me Jazz. That's how I know we done hit home. We there now.
But as she stated, you have to incorporate these tools. So one of the things she said, I'm just going to go over this real quick. She said, number one, holistic self-care. That can include stress management. I know for a fact, stress is the culprit to flare-ups. One of the culprits to flare-ups. Two, journaling, get engaged, writing your symptoms down. And that's one of the things that I offer in the Navigating IBD 6-week blueprint is an option for you to journal. Write down how you're feeling today. What symptoms are you having? What did you eat? What caused you to have this flare up? You have to take back your health. And it starts with these simple tips. Number two, she stated advocacy. You got to show up for yourself. You got to be intentional, right? It's not a woe is me pity party. Yes, we know you're in pain. We know you're having this flare up, but you are your best advocate. You have to smile even when you don't feel like smiling. Because remember, the body does what the mind does. So if you smile, do you know how that reacts to your body? Right? Number three, a support system. Get involved with community who believes in what it is that you're going, like they know what you're going through. The Stephanie A. Wynn Foundation, our goal is to not just talk about inflammatory bowel disease or the acronym IBD. Our goal is really to educate you on, do you know your rights as a patient? Do you know what inflammatory bowel disease is? Do you know what Crohn's disease is? Do you know what ulcerative colitis is? Do you have a gastroenterologist that is helping you manage this condition? Do you have a primary care physician? These are all the things that you're going to need to advocate for your health, right? And so this has been a wonderful interview, Dr. Jasmine Cohen Young. We are super excited to have you here on the pod. You got to come back. We're excited that you're going to be at the 3rd annual Let's Talk IBD Health and Wellness Symposium. Listen, if you haven't gotten your ticket, get your ticket now because, listen, it's going to be amazing. So I just want to tell my listeners today, listen, you're not alone. You are not alone. And that's one of the things we're having at the symposium. We're going to have that You're Not Alone expert panel where we have IBD patients, gastroenterologists, licensed clinical social workers on this panel. And we're going to have a discussion. We're going to have Wendy Wesley, who's going to be the registered dietitian, who talk about nutrition, like the real nutrition, not a diet, but nutrition. And so we have to have these discussions in a safe place. And so I'm super excited. I can't wait for you to get in the building because it's going to be, when you walk in, it's like going to Disney World.
And who doesn't love going to Disney World?
But I thank you so much, Dr. Jasmine Cohen Young, for coming in and impacting our community. Oh, how can they follow you?
If you are in need, if you have questions, if you need support from a mental health standpoint, you can always reach out to me on Instagram. You got minds.matter. It's MINDZ.matter, MATTER. You can go to mindsmatter.org. You can follow me on Facebook. You can do Minds Matter 501c3. I know it's long, but you got to put all that in there to find me on Facebook. Or you can email me. I'm available by email, info@mindsmatter.org. So I'm available. I'm here to support you. I definitely believe in the mission. I'm not just one of those walkers and talkers. I will call your doctor. I will talk to your physicians. I will ask them why are our patients not being supported, and I get answers. So if you need the support, I'm here for you. I'm here.
This is what I'm talking about. We're making a difference. Listen, if you all don't know, we're making a difference over here, and we're making major impact. 2025. We are making major impact, and we're getting outcomes, positive outcomes. And so I thank you so much again for tuning in. For my listeners out there, don't forget to grab your autographed copy of the Navigating IBD, a 6-week blueprint for better gut health. The link will be in the description. I will put Dr. Jasmine Cohen Young's links for you where you can follow her, reach out to her. And again, let's get our mind right, y'all. We got to get our mind right for 2025 and beyond. Okay. Until next time, peace. Thank you so much for tuning in to the Health and Healing from the Inside Out podcast, an online health and wellness podcast where I, your host, Stephanie A. Wynn, will provide weekly wellness tips about inflammatory bowel disease, specifically Crohn's and ulcerative colitis. Be sure to select the subscribe button and let's start the health and healing process from the inside out.